Hello and welcome. In this video, we will talk about SBAR, also called the BAR approach, in handing over a patient to your colleague or talking to an examiner during PLAB 2. What the SBAR approach really is, let's find out. So S stands for situation, B for background, A for assessment, and R for recommendation. Let's talk in detail. So with situation, or S, we mean to tell the examiner that what's happening at that particular point in time. For example, Mr. X, age 55, presented to emergency room with sudden loss of consciousness. Next is the B for background, which is a clinical background, of course. For example, patient is a known case of coronary artery disease. He has a risk factor of dyslipidemia, hypertension, and his strong family history of coronary artery disease, and social history includes he's a smoker of a pack per day for 10 years. Next, A stands for assessment, which includes your diagnosis, what you think is happening to the patient, and what intervention you have provided so far, and what else can be done at that particular point in time. And finally, recommendations, which will be your further management plans involving seniors, any referrals you want to do, and safety netting. Now let's put it into practice. You are an FY2 in emergency. Mr. Peter John, age 55 years, came to the emergency room for chest pain for last 30 minutes. Please assess, manage the patient, and at 2 minutes mark, talk to the examiner. Mr. Peter John, 55 years old, male, came to the hospital for chest pain for the last 30 minutes. He is a known case of dyslipidemia and using statins for the last 5 years. Other risk factors include strong family history of coronary artery disease at young age, and he's a smoker of 1 pack per day for the last 10 years. On assessment, an ECG was done, and it was found that he has ST segment elevation in the inferior leads and his troponins were elevated. I'm suspecting acute inferior MI. After talking to my seniors, I want to admit the patient. Treatment already given to patient is oxygen, morphine 5 mg IV for pain relief, sublingual nitroglycerin, and aspirin. Now examiner might ask you, what's your further plan, doctor? So the answer would be that my further plan includes, after asking my seniors, I will do cardiology consult and transfer the patient to cath lab for possible angiography and angioplasty. Alright, so this is how you effectively communicate with the examiner when only 2 minutes are left. Stay tuned for my next video in which I will put this approach to practice in cement scenarios. Thank you for watching.